Welcome in to the Brave and the Attempt podcast. I'm your host, Wyatt Spalding, health messenger and special Olympic athlete. Today we have with us medical doctor at University of Nebraska Medical Center, Sarah Smith. Sarah, how's it going?
It's going well. How are you, Wyatt?
I'm good. Sarah I met Sarah. We're on the board together, the special Olympic board together, and I saw that she worked at UNMC, and I knew she'd be a great person to interview for this podcast. So, Sarah, why don't you just start out by kind of telling us your background, where you're from, and where you grew up?
Sure. So I am from Omaha, born and raised. And I think the question you'd sent me was kind of how athletics had affected my life and how that influenced me over time and growing up. So I put some thought into that because I thought it was a nice thing to reflect on. And going back, my parents had me signed up in all sorts of activities as a child: dance, volleyball, softball, swim team. I tried a little bit of everything. I didn't really excel at anything, but I had a lot of fun and stayed active, which I think is the whole point of things, is to have fun and be active, right?
Yeah.
I also just spent a lot of time running around outside with kids in my neighborhood and have really fond memories of that. Bike rides around, and just being active and having some hobbies and some healthy competition.
Yeah.
Um, my parents kind of instilled some good, healthy models and role modeling as well. My dad was an avid jogger, and sometimes we'd go to the track with him and hang out. My mom would feed us a lot of vegetables, which I would sometimes complain about, but now I am very grateful that she helped me acquire a taste for some of those. And I now feed all of my kids vegetables, much to sometimes their argument, but
Yeah.
I strongly believe it's good for them. It definitely is.
Yeah.
I went to Ralston High School in town, and I played on the tennis team. Again, not an all-star, but had a lot of fun and it continued to stay active and really enjoyed that team aspect of things and that mentality. After high school, I went to Creighton for undergrad. I did my pre-med coursework and got a bachelor's in psychology. And things started to get a little bit harder in terms of balancing all of the things I needed to do with coursework and applying to medical school and work that I was doing. So that's when I started to really think about how to take an approach to being a healthy person, holistic approach, and how we need to really strike a balance between our hard work that we do, but also the activities we engage in and how we maintain our health and well-being that way, and how you have to be kind of conscientious about it. I was able to go to UNMC for medical school, which was a challenging but positive 4 years of my life. And of course, medical school can be pretty rigorous. So still putting my all in there and maintaining that sort of healthy lifestyle was really important. We have to decide what we're going to specialize in when we're in medical school. And I was one of these students that I really liked everything. If I was on an ophthalmology rotation, I wanted to be the ophthalmologist. If I was on a surgery rotation, I wanted to be a surgeon, So it was hard for me to narrow down what I wanted to do. And ultimately, I settled on the field I'm in now, which is actually two fields put together. It's a combination: internal medicine and pediatrics, where I get exposed to a lot of people, a lot of medical conditions, and it really embraces care across the lifespan, preventive care, and how we care for a person as a whole. So that same, child, young adult, our aim is for that person to continue to be able to experience life to the fullest when they're elderly, right? So how do we help people maintain their health and well-being across the lifespan? So I applied to that combined residency program, internal medicine and pediatrics, and I did my residency down in New Orleans at Tulane, and had a really good time, as good as residency can be, because it can be kind of brutal, but really great people down there, and I feel like I really got a wonderful training and a very just rewarding time. It really reinforced that interest I had in caring for people across the lifespan, and this is also when I really started to hone in on this care for people with intellectual and developmental disabilities across the lifespan as well. And I also have an interest in youth with chronic conditions as they age. So I had some time in a sickle cell disease clinic down in New Orleans as well. So yeah, that's kind of me
That's a
up
lot of
until
that's a lot of schooling, I feel like.
it is. It's a lot of schooling. I look back, Wyatt, and I I don't know if I could do some of that all over again. I'm glad I did it.
Yeah, I always
I'm glad.
admire people like you that do that, because I think when I was like in elementary school, someone explained to me what a doctor does. Like, yeah, you have to go through all this school. It's like, yeah, I'm not doing that. I don't know if I want to keep going to school, but yeah, that's awesome. You got to go to New Orleans. Probably more work
Yeah,
than fun, but um,
yeah, but I recommend that city, Wyatt. If you've never been and you're
okay,
looking for somewhere new to go, I recommend it. I'll give you some tips.
all right, cool. So you say you kind of deal with people with chronic illnesses. Like maybe go into more detail, like do they like, is it like you see them from kids up to like adults, and then you just throughout their life, or do you do a certain age?
Good, good question. So I basically do it all, or
Okay.
I will. So I I work at a clinic with Nebraska Medicine, UNMC, and you'll hear us called med peds,
Mhm.
short for internal medicine and pediatrics. And that's just referring to the fact that physicians like us are dually boarded. We've done all the training and are board certified in pediatric medicine and adult medicine. And as such, we sort of have this ability to target this niche group of patients that are young adults or adolescents that are sort of aging out of pediatrics into adulthood. And that's where my interest really lies. So I do have a general pediatrics part of my practice where I see pediatric patients. I have a pretty robust adult internal medicine clinic, but then I've also been growing my patient panel of particularly adolescents and young adults with intellectual developmental disability and chronic conditions. So um, that's a lot of what I do right now, and that's where I'm trying to expand my practice as well. A big area of interest for me is that transition period from pediatric to adult care. It's been noted, it's been documented, lots of studies showing that that is a really hard transition for patients and families to navigate. The pediatric model of healthcare is really different from the adult one, and it can be hard for patients to make that change from, their pediatric physician that they've known or provider that they've known their entire life. And then all of a sudden they're 19, 20, they've got to go meet this new doctor in this new healthcare system that doesn't know them, might not be as familiar with their healthcare conditions. So how can we help ease that transition and help optimize health going forward?
Yeah.
So that's where I'm putting a lot of my efforts lately.
Yeah. Yeah, I've gone through that like two times at least, because one was I was like 21, so I got a new doc, and then I
Yeah.
moved. So when I moved to Lincoln, it's like, okay, I have to find someone. And then so that, yeah, someone that has like have health conditions, it is hard, because it's like, all right, here's a lot of my medical history, just like this huge file, and then you have to try to explain it. And I mean, I do have my parents tell me out, but it is like hard, like first time you get sick and you go to them, it's like they kind of just ask you a bunch of questions, like, well, what do you usually do? Or like maybe they have a different way that works better. It's like, well, I'm usually on this. I take this amount if you can remember it, if you're me and you
Yeah.
remember. So yeah, I could definitely see how it is hard, especially if you just had a doc for years that knew you, and then or if that doc like retires or something. Um,
Right. Yeah.
so yeah, and then I guess you build a relationship with them too. So it is hard to build another relationship. But what if you notice with people with intellectual disabilities or just disabilities in general, like why they kind of have more health concerns, or do you see some of the same health concerns in people that don't have intellectual disabilities, or is it more people with intellectual disabilities that you think have more health concerns usually?
So that's a really good question, and I'm gonna comment more on the adult population here than pediatrics
Yeah.
population.
Yep.
So we know that our adults with intellectual developmental disability do have more medical issues and sometimes have poor outcomes. And there are a few reasons for that. One is access to care can be difficult. So while there are ERs, urgent cares, and even clinics, a lot of places, sometimes it can be hard to find a patient-centered medical home that is a good fit for a patient
Mhm.
and that can really cater to the individual needs of that patient. And there are a couple of reasons for that lack of clinic availability or medical home availability. One is that we don't have the best training in place for medical providers for our patients with intellectual and developmental disabilities. Unfortunately, there hasn't been a big piece of medical education dedicated to that. And we're trying to change that, but the fact of the matter is at this time sometimes it's harder to find a physician or a therapist or other care provider who has the expertise, the wherewithal, the ability in their clinic setting to see a patient with disabilities, sad to say,
Yeah.
and so there's that piece. There's also the system, the healthcare system, I think is fragmented in a way, which makes it hard for the necessary communication to occur for comprehensive health to be delivered, if that,
Yeah.
so um, there's just not a lot of support within the system itself for helping patients navigate and get the care they need.
Yeah.
Um, I don't know if you've experienced that. I think that's universal. It can be hard for anybody to have to even just schedule a doctor's visit sometimes, or if you're admitted to the hospital, it can be really challenging to know what's going on. You see so many faces, people coming in and out of the room.
Yeah.
Um,
Yeah.
so
It is hard because like transportation is a huge thing. Like my
that was one
parents,
thing.
yeah,
Yeah.
it's huge, and it's like, well, the bus only leaves at this time, and my appointment's like 4 hours from now, but I have to leave now. Or if you're lucky like me, you've got parents or a provider that can take you to all of them. But if you're not, then it's like, well, how am I supposed to get there if I don't drive? Or I have some friends they can only drive at certain parts of the day. So like, let's say in the wintertime, your appointment's at like, I don't know, 4 o'clock. Well, it starts to get dark. You can't drive then. So that is hard. And then, weather in Nebraska, you never know. So yeah, I think that's a big one. And luckily I've never had a problem with like being able to be admitted to the hospital, but that does happen because I mean they have benefits for us for medical, but it is really confusing. And
So confusing.
it is. And my
I
it's awful sometimes. It's rough. My parents have to
I
deal with it. So
yeah, I yeah, I don't know. I hear what my patients and their families go through with jumping through these hoops to get their coverage, and it's just it can be a full-time job just to stay on top of it.
yeah.
So yeah, there are these social determinants of health with like the transportation is a really big one, Wyatt. I if patients can't get to the clinic because they don't have a ride, or maybe they get Moby to bring them or something like that, but like Moby will only wait for so long before they can,
Yeah.
or they're going to leave them at my clinic. So we have to rush through the visit to try to get it done and not take the time we should. Those things definitely are contributors. to why healthcare can be more difficult to access. And
Yeah.
also there's some constraints on us on the provider side. And I don't know if you've noticed, but sometimes healthcare visits, like they're expected to be pretty snappy, right? We have to
Yeah.
get through we have 20 minutes left, 15 minutes left to get through an entire patient visit. And that's can be really hard to get through everything we need to get to, or to communicate with people in an effective way as well.
Yeah.
So that's yet another barrier that we see that we
Yeah.
have.
Yeah. Like I gave a presentation the other day to a class at Creighton that these students are going into the physician field, and I just like how to talk to people with disabilities. And some, like, we all communicate differently, but like it just depends. And like even like I'll be like, what do you what are you saying? I didn't go to medical school. I have no idea what that term means. So then you have to like go into it. I have like a swallowing issue. So like, so one time they had to draw like a diagram, like here it is, here's what's happening. So like that takes time too. And then you have to try to process all that. And let's face it, like I think a lot of us, I don't know, I wouldn't say all, but a lot of us that have disabilities and medical conditions, you have anxiety. So it's just like overwhelming. So if you have like 20 minutes, you're kind of like, what just happened? Like, you know,
I
I,
know. And if add to that, if you are not feeling well at that time or something like that, if you're sick, it even makes it harder to
yeah, yeah.
really take it all in.
Yeah, and
So
sometimes you can take it in with a cold, or sometimes like you got a 100-degree fever, your lungs are wheezy. It's like you can't even like process that you're at the doctor. Like
yeah,
that's why you need a provider. Or like I don't like my parents going with me to appointments. I'm 29. But it's like I need them to because I have a lot of stuff. It's really hard to keep up with everything. So it's just nice to have someone else. But yeah,
mhm,
but like have you ever experienced like people with disabilities, like just like a you see, let's say you see like several people with a disability in one day, but they have different levels of communication, and
mhm.
like how do you like process that, or you know get your point across?
That is another good question. I so I my approach is to be flexible and be creative.
Mhm.
And I first and foremost, I always, when I go in a room, I always say hi to the patient first, no
Mhm.
matter what. Even if I know that that person is maybe nonverbal or not able to say hello back or whatever, I always go in and say hi to the patient first. Then I acknowledge and say hi to the caregiver who may be with them, whether it's a parent or, whoever. But um, I go in the room and I really sort of feel it out. If I know the patient and I kind of know how they're gonna communicate well, I'll adapt to that more quickly. But um, I always start and address the patient first, like I said, but then I am quite open and will often also ask caregiver parents for input and advice.
Mhm.
Sometimes if a patient comes in who is nonverbal, but we know they're uncomfortable in some way, we just don't know why. We've got to figure it out though. We're going off clues. We're going off, how they might be sitting a little bit differently than they normally sit, or their vocalizations might be a little bit different than usual, or their walk is a little bit different. We're just not sure. Um, I'll rely on a lot of those clues and then uh, talk to parents or whoever else is supporting the patient. Um, and then I keep it as simple as I can, but I think that's a good rule of thumb for all of us practicing
Yeah,
medicine. I think we all very easily slip into sort of the jargon or, our words and medical terminology that really we went to school all these years for. We can't expect everyone else to
yeah,
know all these big long words. That's what we're here for, to help people navigate all this. So um yeah, I've definitely taken to drawing pictures or making diagrams, all sorts of things. I have patients who come in with communicative devices. Um yeah.
yeah. I think like
Sometimes if I have a patient with autism and we know that they are kind of getting overwhelmed, or maybe there's too much going on right now, I'll take a moment, I'll step out of the room, I'll say, let's take a little breather, or what can we change the scene in some way? What can we do different to help accommodate this person so that we can provide them healthcare in a way that helps them?
Yeah, I think that's all really good because I think the big thing with me is like as long as like you can like talk to their parent or provider, but like you know I I think it's good like you kind of talk to them too because it's like I've gone into appointments where it's like they just talk to my parents. It's like I'm the one dealing with the medical thing. I know how I feel.
Yeah.
It's like dude, like talk to me. Like they'll talk to you, but like not in the serious moments. And it's like I need you to look at me in the serious moments because that's like the most. That's what I'm dealing with here. Like and I think too, in like sometimes I might not have as many questions as my parents do because I don't think of them or I think of them later. But still, it's like if you talk to them, like you can talk to me too, or just look at me. I think, and I assume we do a really good job. It sounds like of that because we just want to be like respected like any other patient, and we're going through this medical thing, and like it probably is frustrating. Like you said, the person with autism, they're frustrated, but maybe they can't express themselves, and it's very difficult. And then on top of that, you have a medical condition that you came in for, so you just have all this stuff. So yeah. Um, so let's talk about like kind of how you got involved with Special Olympics. What made you want to join the board? You just joined the board this year, which we're happy to have you, and kind of talk about like your decision to apply to come on the Special Olympic board.
Yeah, brand new to the board, very excited for this opportunity. I was, Carolyn Chamberlain was introduced to me by Brad Core, who is a physical therapist who has been on your podcast before. I used to work with Brad, and he's just got a great passion for
Yeah,
what he does as well. So he got us connected, and I met with Carolyn, and she explained a lot of the goals and objectives of Special Olympics Nebraska, and they really resonated with me. And I'm at a point where I've kind of, I do my job as a physician and uh, providing healthcare,
yeah,
but there's only so much I can do within an exam room,
yeah,
and the well-being of people is so much more than what happens at their doctor's office. And I tell all my patients to stay active, to try to eat healthy foods, to do all these things to help them maintain health and wellness as they age. And I think Special Olympics is a program that helps provide those resources to people that are so very important to them. So I wanted to be able to support that organization. And I also wanted to learn more from the organization. Part of my journey and my practice and in what I'm doing, I have learned so much from my patients, from the families of my patients, from the organizations that I've encountered, that have helped me, I think, enhance the way I practice and the way I uh, interact with my patients too. So I'm really excited to try to be able to make an impact outside of my job as a physician, and then also just continue to learn more.
awesome. Have you ever been to like healthy athletes or a Special Olympic sporting event?
I I've been to some of the tennis,
Okay,
but I haven't been to a lot, Wyatt. I did do the polar plunge this year for the first
awesome.
time, which I
Yeah,
know is not an event per se, but I'm looking forward to getting to to more events and um, helping
yeah.
out
I
too.
think yeah, someone having someone like on the board, I think would is going to help with healthy athletes, or and
Yeah,
you could come into tennis. I play tennis, so I'll probably see you there now. So
nice. Good.
yeah, I think it's great that we have people like you on because like I don't know, like people like health is a big thing now. Like when I came on, it was still a big thing. Like when I started, which back in like '08, I started playing, and now it's just like even growing bigger and bigger. So I think it's pretty big. And one of the things that I've learned that some of these athletes, like the only time they go to the doctor is healthy athletes, which is kind of crazy because it's only like once or twice a year, and it's like, um, yeah, it's just kind of insane. I didn't really realize that until like probably one of the USA games I went to. We did healthy athletes, and just like seeing these athletes, like, yeah, I never had my teeth checked, or I haven't had this doctor's appointment in 2 years. So hopefully we
Yeah,
can change all that because I bet they want to go to the doctor. It's just it's hard to, like we said, to get there.
there are
So
those barriers. So this is a way of breaking down some of those barriers and
yeah,
helping people
for
access
sure.
care and helping them learn how they can. I think people also can learn how much they can kind of advocate for themselves too
Hmm.
and think, oh, I deserve this. I deserve a dentist. I deserve
Yeah,
the right to see a doctor and get my health taken care of. So
yeah, yeah.
it
Like
sends that message too.
I think too, like sometimes it's like, oh, it's just this pain, or like for me, I have cerebral palsy, and you have a certain pain with that, and it's like, you speak up like, no, it's not my disability. Like there's something wrong. Like I know there's something wrong, you know.
Mhm.
So I think like speaking up is big, whether it's an athlete like me or a physician like you, like speaking up for the athletes, or if they for some reason verbally couldn't do it themselves. What do you hope to see in the next couple years or future for people with intellectual disabilities and physical disabilities improve in the healthcare system?
Oh, so I hope that we have I something that I'm working on is improving that education piece for
Hmm.
our trainees that are coming up in medicine, because I think we need to have more people in the healthcare field who are able to care for our patients with intellectual developmental disabilities. So whether that's more education to our medical students or the residents I work with, who I also work a lot with our residency training program. Um, I'm hoping we see more of that so that we can produce more doctors
Hmm.
and other providers who can care for our patients. I am and a lot of that, well, back to that actually, I I hope to also, aside from just producing new doctors who can be good care providers, kind of help our current ones feel more comfortable in
Yeah,
their ability to care for patients with IDD. So, reminding them that to treat everyone as an individual. We're not gonna find people in textbooks. Nothing's in a textbook. Nothing's like the book, right?
yeah,
Um, to treat the patient like we were talking about, always address the patient and make sure that they remain the focus of the visit or of the care. I also I want to make sure that every patients with intellectual developmental disabilities, sometimes their healthcare maintenance and healthcare screenings are overlooked.
mm,
So, for example, sometimes people assume that patients won't want to get a colonoscopy for colon cancer screening, which is not an assumption we should make. Um, Everybody deserves at least the opportunity to be offered colon cancer screening. That is something that is a standard of care. So I can't assume that just because someone has intellectual disability, they don't want to have a colonoscopy, right? I mean,
mm.
nobody really wants to have a
Yeah,
colonoscopy, but um, we can't overlook all the healthcare screenings that we offer to the general population. So I want to make sure patients are offered all of those things. Um, I think another, as kind of related to that, we also frequently overlook the topic of sexual health when it comes to patients with developmental disabilities. And it's something we just pretend isn't a thing. I also want to make sure that that's something that people have access to. Um, and I just want to have a real team approach to healthcare. That's how I work within my primary care clinic. I'm frequently communicating with physical therapy, occupational therapy, psychologists. I work a lot with the people at Mineral Meyer Institute, for example, and other specialists in ENT, pulmonary, et cetera, neurology, and also social work. We talked about how navigating the barrage of paperwork that comes along, or all the legal things that come up, whether
Yeah.
it's guardianship topics or supported decision making, or making sure insurance doesn't lapse, or whatever waivers might be needed, etc. How do we work through all of that? So really that team-based approach, which
Yeah.
is, it's kind of going back to this concept of a patient-centered medical home, which is what I'm striving to develop.
Nice. Yeah, like I mean, yeah, we could talk about a lot of those topics with you all day, like insurance, like that's always just gonna be a pain. I think because they always change,
Oh,
or like like I need certain drinks because it's basically my food. They'll cover one drink but not the other, which makes no sense because they're both a medical thing. And then yeah, just a bunch of stuff where it's like I'm on the phone with them because I'm my own guardian, so they have to I have to give them permission to talk to my parents. I'm like, it's like, wait, why are you calling me that? And why do you need to know this? I just go into it. And so, but yeah, stuff like that, or like, the sexual part you said, like, yeah, like there are some topics they think like they shouldn't talk about with us, but we are adults, and it's like I mean, come on, like we're adults, you got to tell us all the health facts of everything, because I mean, in my experience, I've been in the hospital, and if you talk to me about something awkward, that's going to be kind of awkward. That doesn't bother me because being in the hospital is kind of awkward, and you have to just deal with it because it's just like I don't feel good. Just want to go home. I don't care if this is weird or embarrassing. It's like let's just get this done so I can get out of here. So, and I think a lot of people with disabilities, like they don't mind the awkward conversations about health because the ones I know, they're pretty blunt and just like they want to give it straightforward, tell me what it is, and they don't care. They just, if you kind of go around the bush, that's when we don't like it because it doesn't feel like you're treating us like an adult. So, yeah, I think that's great that you kind of want to get into those topics. And yeah, there's just, I don't know, there's a bunch of stuff with healthcare that is good, but, isn't for people with disabilities. It's a struggle some days. So, do you ever like how important is like kind of their home life to their health, would you say?
I
Is
think it's very important, Wyatt. I think that's important for everybody, Um, going back to, I'm seeing people for just a slight fraction of their life in my office, but all the things that contribute to their health and well-being are really happening at home, at where they might work, at their,
yeah.
programs at school, whatever.
Mhm.
So what they're eating, drinking, doing at home, if they're just sitting around all day, that's not good for anybody,
Yeah.
or if they're just drinking Mountain Dew and not, it's, so that stuff is very, very important. And I think it's also really important that we all have something to really like make us feel like we have purpose or meaning, whether
Mm.
it's some sort of hobby, or it's work, or it's something that we engage with other people, or whatever, just something that adds to our completeness as a person,
Yeah.
So the answer to your question is, home is extremely important.
Yeah, for sure. I know some athletes like their only exercise is practice. They go to practice
Mhm.
and they're like, yeah, this is like what I do. It's like, well, why don't you just go outside if it's nice? Or, and I think we see more athletes like that now that healthy athletes has grown and professionalism has been big on health. You see athletes go shoot hoops at the Y or in the park or go for a walk. Because I think a lot of times when it started, it was just sports, and now with the health thing, I think the elite division, there's like an elite competition in tennis. So if you want to do that, you got to stay healthy, and I think that's pushing athletes more to, want to stay more healthy, eat the right thing. So I think if you push competition, I think that will honestly help their everyday life, what I've seen. So
It's a
that's what
real
I've seen.
motivator. That's
Yeah.
great.
Well, thanks, Sarah, for coming on and uh, telling us your story. And we can't wait for you to be part of the Special Olympic board this year and help us grow in health and just sports. So thank you.
Thanks, Wyatt. It's been great.
Yeah.